All right, good evening, everybody. We are recording this just so everyone knows to send it out to those who are probably working tonight or can't be with us. But we'll stop recording at the end if there's questions that you don't want recorded or shared or that kind of thing too. So I am Mary Coleman. I'm the RN-BSN coordinator at Appalachian State. So really close to y'all, and this is my 4th year at App, 3rd year as the RN-BSN coordinator. My clinical background is PICU and Peds Critical Care Transport. I worked at Baptist in Winston and at East Tennessee Children's Hospital as well in their PICUs. And but I've been teaching in the RN-BSN program and as a clinical instructor at App for several years now, and love helping students really navigate this process, figure out what classes to take, where to take them for prereqs, how to work through the whole process. And so we're here tonight to talk about what this looks like in our program, what it looks like as far as prereqs, how to get all those done, what our whole program looks like. So we're so glad to have you tonight. Jane, would you mind to introduce yourself also?
Sure. Hi there. I'm Jane Dowdy. I'm a transfer admissions counselor and associate director in the Office of Transfer Admissions and Engagement at Appalachian. So I actually work with folks in the Watauga County area. So I would be your transfer admissions counselor. So I'm super excited to be here tonight.
Mhm. So thanks everybody for being with us. So, you're here, you're thinking about a BSN, but what our goal is when we're thinking about this BSN is that we know that you all have existing knowledge. We know that you're giving excellent care at the bedside, and we really want to enhance that. There have been some studies that found that nurses with BSNs report feeling better prepared in quality and safety, and that an increase of BSN prepared nurses decreases patient mortality. Um, and I think that a lot of this is probably due, and I think you'll see this throughout our program, is the emphasis that we put on evidence-based practice. We talk a lot about how to escalate your concerns in a way that will be heard, right? And how to work through different root cause issues and different quality issues, and how to implement projects, analyze data, all that kind of stuff. So why a BSN at App in particular? We've got several different options as far as programs. Our most popular program is our 12-month, which is 1-year program designed for people who are working professionals. It is very affordable. So we also, so about $225 per credit hour this year. It is all online, and you don't ever have to come to campus, even though campus is not very far from where y'all work. And it is also asynchronous. So that means that there's not a certain time that you have to be logged on. Typically, assignments are due on each Monday during the semester at 8 a.m. You can work on them. You get your whole semester when we start, and you can work on them, during the week before they're due, or, ahead if you need to. You can work on them during the week that they're due and turn them in at any point that works for you. So we've got people who work weekend option who get them done, before the weekend comes. They get them done Monday, Tuesday, Wednesday. Or we've got people who work Monday through Friday and they get them done over the weekend, or whatever works for them. We've got people day shift, night shift. I'm getting emails from students at all sorts of different times of the day and night, and that is what we're used to, and that's how we operate. Is we don't require you to be somewhere at a certain time. The other thing that's really special about our program is that we've worked very hard to have experienced faculty, and we are almost entirely full-time faculty teaching in our RN-BSN program. So when you're comparing programs, that's something to ask about, something to think about, because sometimes you'll see RN-BSN program staffed with adjuncts, which adjuncts are great and certainly have their place. But with our faculty being full-time faculty, they are really invested in the curriculum. They're actively involved in nursing education research. They're teaching, kind of throughout the curriculum and throughout the programs. So you've got really great experienced faculty who are used to helping students, especially students who are working nurses. That's what in our RN-BSN program, and then our master's program too. Working nurses who have lives, have families, have things going on. So you've got experienced faculty who are used to helping with that. And then we've got great student support options. We've got a dedicated nursing advisor once you're into the program to help make sure you're on track to graduate, all that kind of stuff. We've got a writing center that's really helpful. We have a librarian for the health sciences, and he's great and comes to our orientation every year and then is available throughout if you get stuck on research things. We got lots of options as far as student support. And as far as our some background on our department, we are part of the Beaver College of Health Sciences in Leon Levine. And the Beaver College of Health Sciences was founded in July of 2010, housing the communication sciences, health and exercise science, nutrition, healthcare management, rec management, and PE, and social work. And you'll find a lot of your professors are doing interprofessional work with some of these other groups that are in our building. And we've got the PA joint venture with Wake Forest, lots of things going on in our building as well. Our RN to BSN program itself started out as a distance program years ago and was a weekend program, had a little bit of option during the week, but a weekend program students came to campus for, and then it went entirely online. So it actually predates the College of Health Sciences. And we also have a Master's of Science in Nursing Education, specifically a nurse educator program and a nurse educator certificate. So if that's something that you're interested in, it also flows really nicely. A lot of our professors that you're used to from the RN-BSN program teach in that program as well. It's the same learning management system. It's a pretty similar setup. So, something to kind of think about if that's where you would like to go also. And we're Board of Nursing approved and also CCNE approved as well. So our program, I'm sorry, my slides are a little bit slow tonight. We have 1, 2, and 3 year plans. So what we have with our 1 year program is that you take classes in the fall, spring, and summer, and then you graduate at the end. So you start this August and you finish up the next August. It is fast paced. It's one of those programs that you really do school and time with your family, and that's about it. It's not one that you're going to have a lot of extra time. Probably somewhere between 15 to 20 hours of work a week. Okay. So more than one day, full day of work for the 1 year program with us. But it's fast. It's one of those things that if that's what works for you and you want to put your head down for that year and not go on vacation during the times that we're not on break or that kind of thing, be really focused during that time. It works really well for some people. I'd say the majority of our students are in this 1 year program right now. We also offer a 2 and 3 year plan. These are fairly new as of, I think this time or so last year. Typically we had great response and involvement in the 1 year plan, but we also have added this 2 and 3 year plan because we've seen nurses are tired. We know y'all are working a ton. We know you've got a lot going on. And our students need a little bit more flexibility. So we have 2 and 3 year plans. If you look at this 2 year plan, it's 2 classes per semester. And then it goes to 1 class per semester for the end of the program. So you get started in your coursework, and then, as you finish up and you get into some of these other classes, they go to 1 class per semester. So then in our 3 year plan, it is 1 class per semester. So if that's, a kind of a slow and steady pace, that works well for a lot of people. As far as getting into the program, one of the first things you have to be admitted to university at large. You have to have your completed associate's degree or diploma, current license in North Carolina or a compact state, of course, and a cumulative GPA of 2.5 across all your coursework. We do ask that you've completed all of your prereqs before you get into the program. And then we'll talk more about our compliance stuff in a little bit, but you do have to provide your health records, immunizations by the time it's typically November 1st after you've started. When we think about transferring credits and that kind of thing, let's see. Sorry, my slides are not keeping up. Okay. Um, all of the courses within our RN-BSN program have to be taken at APP, but we've got a comprehensive articulation agreement with the North Carolina community colleges to help transfer your credits in and see what transfers well, to really try and make that as seamless as possible. And then you also, after nursing 3011, which is our concepts of professional nursing course in that first semester, we also give you 30 hours of credit for previous learning clinical competencies. You don't have to do anything for this. What it does is, besides past nursing 3011, what it does is it gives you credit for the clinicals that you completed while you were in your associate's degree program, some of those kind of intangible things, or maybe professional certifications that you hold, years of practice, all that kind of stuff is kind of bundled together into this previous learning clinical competencies that all of our students get. As far as the requirements for transferring, it really varies based on your background. If you have a previous bachelor's degree, then your requirements are a little bit different, or so we have here our transfer admissions email, and then I will also turn this part over because Jane can probably speak to it better than I can on how all of this works. Jane, do you want to tell us a little bit more about the admission stuff? Yeah.
Sure, you bet. So in terms of the admissions requirements, as Mary mentioned, you just want to meet general admission requirements for the university, which is just 24 transferable hours and a 2.25 minimum. But in this program, you do need the 2.5. Those are just our normal admissions requirements. So you really need to have the 2.5 for the program. We do have some dates that you can see here. We've got a February 1st priority admission deadline. We'd love to see students apply by that date. That's a good one to shoot for, but we're really, we have that final deadline of August 1st if we still have space. So, because it is online, so you can go a little bit longer with that. It does take a little longer to hear back because there are a lot of requirements in the program, so it doesn't typically take up to 8 weeks. Typically it's a shorter amount of time, but typically it might be up to 4 weeks. So I see them turning it around a lot faster than that, but that's our published time. So that's the one I'm want to also mention too. So there is an App State online application that you apply, and that's on our website. You can go to online.appstate.edu, and when you click undergraduate and then the RN program, there's a big gold button there. So you can find the application really easily. There's a $65 application fee. And then there are, we just need your official college transcripts for any college you've attended. So an official just means that you order them from the institution and have them sent directly to us. So that's just a little bit about how it works. The application process actually is pretty clear cut. It's not super complicated. It's just really getting that application filled out, the application fee, and we have a fee waiver too if you're using financial aid. If you're having to take classes somewhere else, we definitely have a waiver you can use, and then it's those official college transcripts.
And I'll add too, we talked about the prerequisites have to be completed by the time you start the program. But that can mean that if you are still in process over that spring semester, if you're finishing up your statistics class or something as a prerequisite, you can still apply, and you should still apply early in that semester for the program. And we can offer what's called conditional admission, which means pending successful completion of your statistics class and you getting your transcript in and everything, then we convert you to full admission. But we've pretty much done everything that we need to. You have all the information. We've got all the information. You're getting emails from us about orientation, all that kind of stuff. We can kind of put together your whole package, and then we just check the last little box and move you to final admission. So keep that in mind too, that if you've got stuff in progress, that you can most certainly go ahead and apply. And we encourage students to apply early, because sometimes too, if you apply in that February, February, March, or that earlier time frame, and we're looking at your transcript and figure out, oh gosh, you're missing a history class or something. There's still typically time over the summer to take it. So it gives us, and then you can join our fall cohort. We admit each fall, specifically. So, if you miss the fall, you'll have to wait till the next fall to come in. So that's why right now is a really good time to be talking about this. I know it seems early, thinking about for this time next year, our students are 6 weeks into their semester so far, but it is really, if you've got prerequisites, if you've got stuff to gather to kind of make sure everything is in place, it's really the time to start looking at all that. Let's see. And then here are some of advising resources. Jane, do you want to speak to these?
Absolutely. So, we're all here to help. The program does have a lot of layers and a lot of components. So we have a course equivalency tool where you can look up your credits to see how they transfer. We want to help you with advising, like Mary just mentioned, before you come. I know we're probably going to touch on that pre-evaluation here on some of your slides too, but I'll go ahead and mention it as well, just because it's such a great tool. But we have a pre-evaluation tool on the website that allows you just to put all of your information in, and then it will actually give you an email summary back that tells you what you may be missing, to be able to meet all the requirements for the program. And then once, if you have questions and you filled out that pre-eval, you can reach out to me and we'll do a one-on-one video chat and walk through it. We want to make sure you understand it and have, answer all your questions. So we do have if you're going to community college, like Caldwell, for instance, we have RN-BSN transfer guide too, that is super helpful and just outlines everything in detail. So transfer.appstate.edu is just a great resource. We try to give you great tools on that site, so definitely check that out.
Sorry, I was muted. Let me show you. This is also something that is about to be posted on the website. So y'all are getting a little bit of a preview, but it shouldn't be too long before it is. That is a list of, it looks a lot like this self-evaluation. It's a list of the classes that you need. It's not inclusive, but it is kind of a guide. So we've given you some tools in a lot of different ways with this course, with the transfer guides and lots of different things. So especially if you get into some confusion as far as the classes that you need and that kind of thing, please reach out to us. And reach out to Jane. And we know that this process can be confusing. We know it can, and especially if you have coursework that's over 10 years old, if it's transferring from out of state, or lots of different things. Those kind of, we've kind of tailored a lot of it to those who've gone to North Carolina community colleges, but we know that there's a wide variety, and that's what we're here to help with. And we're here to help, of course, the North Carolina community college students too. But just know that those are kind of, when you're transferring older credits or that kind of, we certainly accept them, but they get a little bit more sticky because maybe the credit numbers don't look exactly like they would. We have to look at those a little bit more carefully together to make sure that it's going to transfer like we think it is and all that kind of stuff. So please let us know if you've got questions on that. Some other kind of information about the program. Clinical is a question we get a lot of. It looks a lot different than long clinical days with your instructor at the hospital. So our clinical is non-traditional and asynchronous, which means you do it on your own time. For example, for health assessment, you find a pretend patient. It's typically a friend or family member who's over 18. And you, by the end of the class, do a head-to-toe video of an entire assessment of this person that your instructor evaluates. Or for the community assessment, you do your community assessment in the community that you live in. So you assess your county, you talk to key informants there, you do a windshield survey, all that same kind of stuff. You do it where you live. And so that's really on your own time when you do your windshield survey and that kind of thing. We also do an evidence-based practice project in our synthesis class, and people do that where they work typically. and you interview a manager, you talk to a staff nurse there, and you do a workplace assessment that really figures out what are things that you might want to change or might need to be worked on. You go to the literature to find some good solutions and then go from there. So for example, students will, we had one who during COVID was trying to figure out how, she worked at a clinic and was trying to figure out how to do a flu shot clinic, you know, which typically is everybody's in the room together, moving around. And this was, you know, at the beginning of COVID before people were vaccinated that first fall. And how did you do that, right? How did you have people there and make sure they didn't have a reaction to their flu vaccine, but not have them too close together, right? Or some people have looked at what a float pool looks like for their institution, or getting iPads to help us with discharge, lots of different things. And so it's a project based really where you work and your faculty member walks you through that entire project. So additional fees, we do have lab fees and liability insurance that are part of your program fees. And we carry that insurance for you throughout the program. We do have a clinical requirements tracking system. That is about $150, I think, for the year. And that is, some of y'all may have used Castle Branch, we use Complio. And that helps make sure that everything is, you know, your license is up to date, your TB tests, all that same kind of stuff. And so also there is an orientation fee, but we're kind of working through what orientation looks like for our students. But there is typically an orientation fee as well. As far as requirements, we do require a background check and drug screen in the first semester. We require BLS at the healthcare provider level. You know, we like American Heart Association is what we've typically accepted, but if your hospital does American Red Cross for your CPR, that's fine, and we usually accept that. Immunizations, PPD testing. But after admission, you are given information on how to meet all of these requirements. We go through more information you could ever want on exactly how to do it, step by step in Complio, everything you need. And then it's due, you have to have everything in and due by November. So you start the program in August, it's due by November. So, you know, we give you some time to get acclimated and work on it. You can work on it before, we give it information over the summer too. But lots of time to get this done for students as well. So kind of talking about our department, I'm Mary Coleman, I'm the RN-BSN coordinator. And then we've got Dr. Turpin. Dr. Turpin is our director of academic support and program compliance. So she's over Complio and you know, is just as a program support person. Dr. Raymond is our department chair. Dr. Bernard is our undergraduate program director, and it's really neat because Dr. Raymond teaches research in our program, and Dr. Bernard teaches leadership and management, which is really neat that they're actively involved in our program as well. And then we have a specific advisor once you're accepted into the program and in the program just for the RN-BSN students. Here is Jane's contact information. Here, email, phone number, text number, all that kind of stuff. And she also, like she said, has the capability where you can sign up for a one-on-one chat. Anything else, Jane, on that?
Well, just I will say if you want, please put your name and your email address in the chat tonight, and we'll just make sure we get you just on our email list and to get you information about the program and to stay in touch. That's optional, but I'd love to have your name and email if you want to put it in there.
All right. And then, you know, if you've got, we'll open the floor up, we'll stop the recording and open the floor up right now for questions. My email is here. If you think of questions later on, you're welcome to.
I'll say one thing, Mary, before you're in the recording. I'm Sam Crabb, for anyone who doesn't know. I'm the Career Pathways Coordinator at APPRHS, and I would add one support item that we do provide within our organization for something like this is we do offer tuition reimbursement for our employees. And so if you're looking to go into this program and you're worried kind of about the finances around it, maybe affording the program, our organization does provide tuition reimbursement for all levels for full-time, part-time, and PRN employees. And you can reach out to me or anyone in the HR department about that. So yeah, if you're worried about finances, we do have some support systems in place for that.
Thank you. Yeah, and I will also point out, and this, some of you, this may not be relevant to a lot of you, but we do have a scholarship, a grant funded scholarship for the next several years for those who live in the westernmost North Carolina county. So if you're commuting a little bit, so it's really Avery County over. So here's the list, and I can send this in our information too, that we have a scholarship for the next several years, if they can kind of offset some of that, especially if you're doing tuition reimbursement. We know sometimes it's hard to come up with some of the money right away, so it might help for that first semester and that kind of thing. So I will stop the recording and open it up for questions if people have it. And otherwise, we really appreciate you all either being here or watching this later. We are thankful that you have joined us, and please reach out if you have questions. We're here. We know that this process can be stressful and difficult. So we're here to answer questions. We're here if you get stuck on any part of the process, just let us know. All right.